to Wellness Curated. This is your host, Anshu Bahanda, and in this episode, we're going to discuss the aging brain and tips for caregivers. Now, my aim with this podcast is to help you lead a healthier, more hopeful, and happier life. And we have today with us neuropsychiatrist and geriatric psychiatrist, Dr. Santosh Bangar, who runs the Mind Clinic for Senior Citizens. We have senior political journalist and author and TV talk show host, Priya Sahgal, who looks after her aging mom and has authored a chapter in A Portrait of Aging, a book edited by Zarina Bhatti. And we have neurologist PN Renjen, who is from Indraprastha Apollo Hospital. Welcome to the chat. I will start with you, Priya. So in your article, A Portrait of Aging, you talked about how your mom has had falls and she lives with short-term memory loss. Can you explain exactly what that is?
Thank you, Anshu, for having me on this conversation. I think it's a much needed one, really, because that is something we are all going to face either when we are old or when we are still in our 50s, but when our parents get old. Because now what's happening is, with the lack of a joint family system, it's really the children who are dealing with the parents without much support, and we are kind of looking after our mothers and also not knowing how to do it. So I'll just give you a brief thing of my case study, which I wrote in this book also, if I may just do a bit of advertisement. A Portrait of Aging. We've written what it is, the problems old people face, and I wrote as looking after an older parent. Now, my mother was 79 when she fell down. She had a hip fracture. She had to have her hip replacement. After that, the hip was one problem, but I suddenly noticed that one fine day she got up, or rather, when I went to her bed, she looked at me and she said, "Who are you?" So that was a real shocker for me. Finally, we did the brain scan. We did everything. I think that memory loss was, some people say because of urinary tract infection or whatever. Mm-hmm. She got her long-term memory back. That was just a temporary aberration. But the MRI of the CT scan of the brain showed age-related atrophy, which means there is a decline. Your doctors would explain it better in the brain cells, which which over age you become forgetful. But this was, a speedier process, and she's becoming more forgetful. What is happening now is that she has a short-term memory loss. So when I have to repeat a lot of things in conversations that even if I leave the room and I come back to the room, she'll look at me and say, "When did you come back? Where were you? When did you come?" And I said, "But I was with you all this while." In fact, her favorite question this morning, is she looks at me and she says, "Oh, you exist." So I said, "You are the last person to ask me that." It was to me. But, so she knows events that happen 3-4 days. She gets a little confused. So it's very difficult, Anshu, for me to see a mother who was in control. She was a working woman. She brought me up, to see her so helpless, and be looking after her. I'm a working woman. So looking after her 24 hours, we have to have health attendants and get support for that.
So, Dr. Bangar, I wanted to ask you, so there's been studies which show that the mental processing speed slows down from about 20 years. And then recent studies have shown that actually it's at 60, where our brains are only affected from 60 years onwards. So can you give us your version of it, your feedback with your experience? What do you think?
First of all, thanks very much for inviting me, and it's a lovely forum to share my thoughts. So, as you rightly pointed out, yes, there is a deterioration or decline in the brain cells right from our second decade. And because there are so many brain cells, trillions and trillions, so the process is so slow that the actual manifestations are only in the 5th or 6th decade of life. So by that time, the damage is already happening there. The degeneration is happening there. But when we talk about, this is all normal aging. But when we talk about the disease process, for example, Alzheimer's type of dementia, which is the most commonest type, and we'll come to what is dementia and what is Alzheimer's, because that's a very common question people have in mind. When the Alzheimer's disease process starts, so the brain cells die at a very, very rapid rate. So the analogy I give my patients is, imagine a lawnmower going berserk and chopping all the grass that is there in the garden. So it's that kind of a advanced disease process that happens.
And can you explain to me, while you're discussing Alzheimer's type of dementia, the statement you made? So it'll be very helpful for all our viewers to understand what is Alzheimer's, what is dementia, and what is the difference between the two.
Yeah. So, I mean, this is, as I said, a routine question I answer maybe 10 times in a day, busy clinical day. But dementia
Right.
basically is a syndrome. And by syndrome, I
Mhm.
mean a constellation of signs and symptoms of a brain disease. So the common symptoms that people come up with is forgetfulness, or not remembering recent conversation, or where they put their belongings and things like that, and asking the same question over and over again. Now, mind you, this is different from, say, when we go to, say, another room and we don't know why we went there for, or we
Mhm.
open the fridge and we don't know what we are looking for. So these are different as opposed to what we are talking about in seniors, because age is the single most risk factors for
Mhm.
dementia. So it's not a disease exclusively of seniors, but majority
Mhm.
of them are seniors, so 60 plus and above. So
Okay.
that is dementia. So the commonest symptom is short term memory loss or forgetfulness. Then the other brain functions, which a lot of people don't attribute to dementia, are loss of communication skills, reading, writing. This happens much later in the illness, losing the ability to, say, ride a bicycle, or know how to swim, or how to brush
Mhm.
their teeth, and so on. So that causes problem with their day-to-day activities, and that's where the strain on the carers or the family comes in. So, as I said, dementia is a broad umbrella term. It's a constellation of symptoms and signs. Now, what is
Right.
Alzheimer's? Alzheimer's is a disease of the aging brain. Now, when the Alzheimer's disease causes dementia or gives rise to dementia, it is called Alzheimer's dementia. So
Okay.
it is as simple as that. But what is this Alzheimer's disease? Because the moment we say that, people get very nervous. So basically, it is an abnormal protein that is deposited in the normal brain cells, which eats up the normal brain cells. And hence, all these problems start. You know, I mentioned about the recent or short term memory loss and
Mhm.
all the other language ability, loss
Mhm.
of their judgment and social skills, and social demeanor and all of those. So, loss of decorum. So, all of that is part and
Right.
parcel of that.
Okay. So dementia is the big umbrella term. And tell
Yes.
me, do things like lifestyle, diet, smoking, consumption of alcohol, exercise, reading habits, do all these things make a difference at all in whether you
Absolutely.
develop cognitive issues or not?
Yes. So lifestyle plays a huge role in this. So you mentioned about, say, obesity, so lack of exercise, smoking, excessive alcohol consumption, sleep. There is more and more emphasis on sleep.
Absolutely. That's very, very true. Sleep is such an important thing, and more people seem to be sleeping less. But the other thing I wanted to discuss is, dementia awareness or Alzheimer's awareness has gone up so much more. And one of the reasons is that there's a lot of films and books that have been covering it. But the point is that popular culture is not always accurate.
Yeah.
What is your view on that, Dr. Bangar? Do you feel, is there a book or movie you can recommend for someone who's trying to learn about this?
Uh, I mean, I'm glad you brought this up, because social media and the film industry and other magazines and so on, they've helped us immensely in improving the understanding of the general population. Some of the movies do document that incorrectly, and some of them do ask for medical experts to either tally the story they have written and so on. But I am yet to come across, to be honest, which accurately demonstrates the what a person goes through.
Priya, on that note, I wanted to ask you, I know you're an avid reader. So is there a book or a movie where the tips really helped you? Or that gave you solace or that helped you in any way?
I do agree with Dr. Bangar in that, it's the movies and books, my point of view really is that they tend to romanticize the disease. They make the parents, they're so lovable. They have Alzheimer's. We listen to music. They are childlike and it's so lovely. And, it is not lovely. It is heartbreaking to see your parent become a child and you become the mother, to hear them talk like a child, to argue over chocolate. She's forgotten how to brush her teeth. Dr. Bangar, you said to forget things. That's what she's forgotten. It is heartbreaking. It is adorable in a 2-year-old. It is not so adorable in a 81-year-old. I'm sorry, I have to, and to live through that every day after day after day, it gets too much. So I don't agree. Any movie, any book that romanticizes it, I think it's just, you're just, maybe you're giving hope. You're trying to, build the morale of the caregiver. But, we are living in that reality. We know what it is. You can't fool us. It's just not lovable at all. The personality change. No one, I don't know, people talk about that. The person, because of their frustration, my mother is on a huge regime of antidepressants, because I think there is so much anger. There is so much frustration. This is not the person who was my mother. The person who is now is not the same. How does one deal with that as a caregiver? How does she deal with it? Because there are moments when she's aware, and that's what makes her so frustrated and so angry also. She hates somebody. She's been so independent now that she needs help, because there is also, after the hip fracture, she's lost the confidence of going to the loo, or, just the general things. So there is that added pressure. So the whole frustration, anger, depression, I don't know. There is also a lot of repetition in what she watches. I think that there were red flags. That's the other thing I would really like to know. There were red flags one could have seen. For instance, even before she fell, she stopped going out, and she was a working woman. She just started dressing down. She was not looking after her appearance. She was watching the serial, and she was watching the same serials over and over again. And if a new episode came in those serials, I had to actually look and tell her, no, none of your favorite characters have died, so you can see it. She will watch the same serial over and over again, which is, those 3 limited serials that she has. She watches them again, where, she knows the ending. She doesn't want anything unpredictable.
So, Priya, I wanted to ask you, what is it that actually helps your mom?
What helps her is predictability, the same pattern, the same, to let her know that she is in control while helping her, but at the same time, not letting her know that she's been helped. She has to be in control. If you tell her, if I want her to wake up, she hates waking up, early. So if I say, get up now, it's 10 o'clock or whatever, she will get angry. But then if I say, do you think you want to get up, you want to come and watch a movie, or something, you have to make it sound like it's her idea, when actually you are telling her what to do. So it's just the way you handle things. And, as far as what's helped me is just talking to friends, talking to people. There is no book, no write-up, that has really helped. And talking to her doctors, of course, So it's just, for me also, the unpredictability is something I can't deal with. I really want to know what is going to happen in the next 2 years, next 5 years, where to go, what to look forward to. I want that roadmap. But I don't know if the doctors can give me a roadmap with a disease like this.
So that's a great question. Welcome to the show, Dr. Renjen.
Good evening.
Good evening. Thank you for being here with us today. So we have a great question from you, from Priya, who's looking after her aging mum. Her mum is going through short-term memory loss and depression. And she would love some sort of a roadmap over the next 2 years, the next 5 years, of where they're heading to.
Well, the point is, your question is very appropriate. But the point here is that it's very, very difficult for me to suggest a roadmap for a dementia patient. As very rightly said, it is not what the textbooks or the books write about dementia, but every individual of dementia is a book by itself. They behave erratically, differently. What I would like to first stress upon is that when one starts treating, diagnosing dementia, one must be sure as to what is the type of dementia you are dealing with. After all, dementia is a broad term which includes large number of neurocognitive, neurodegenerative disorders. And each of these take a different course. Now, say for example, I, for one, do not like treating a dementia till I know what I am treating. Broadly, I in my mind would classify whether I am not missing a treatable dementia. Every dementia is not degenerating. We have to look for treatable dementias. Number two, a very common mistake is what is called vascular dementia. A dementia where we have done a lot of work on. A vascular dementia is not Alzheimer's dementia. You may have the two together in the same patient. A VD vascular dementia may convert into an AD. So the question of Priya becomes very relevant. That what do? I would go all out to treat a vascular dementia with medicines, treat him with cognitive therapy, treat him with all sorts of inputs, because I know that I could improve the quality of life of this patient.
Okay. And coming to what you're saying it's absolutely imperative that the dementia is classified as what kind it is. So tell us, what tests does one need to do, and what age should people be doing the tests, and are they available to do at home?
Well, the tests are all available. After all, a patient of, say, a person comes to me and I say it's a dementia. Now, really, I want to know, as I said, is it the right hemisphere or is it the left hemisphere? I want to know that has it involved the frontal lobe? Has it involved the temporal lobe? Has it involved the parietal lobes, or has it involved the occipital lobes? Depression is not dementia. It's pseudo-dementia. So that's exactly what I'm saying. That you have to really ascertain whether there is a dementia at all before you start treating it. And as I just said, then I would like which area of the brain is involved. Then the next what I would do my own examination, which is called the mental status examination, MMSE. Then maybe I'll refer this patient to an experienced psychologist or neuropsychologist who would further help me to tell me which areas of the brain are involved. Is it the frontal lobe? Is it the temporal lobe? For example, you know that Alzheimer's disease doesn't involve the frontal lobe. It predominantly involves the temporal lobe. Next step is the imaging. I'll do imaging. Now, what imaging will I do? Well, we do an MRI scan, and now we have got a molecular imaging, what is called a PET MRI or a CT MRI. We can do a Doppler scan, then to say, yes, that this patient has this form of dementia. Then you take off from that.
I see. And Dr. Bangar, are there any tests that you would recommend to the patients to do when they're, in fact, before they've got to a stage of cognitive impairment of any sort?
As we all know, it's an insidious and a very slow course of the disease. So there may be instances of impairment in their personality, short-term memory loss, and so on and so forth. So the history is of paramount importance, and sir rightly said, neuroimaging and neuropsychological tests, that kind of helps us to put the pieces of jigsaw together to come to a definitive conclusion. But certain tests of cognitive of day to day are like, we can do bedside testing, asking about them, what is for the orientation, basically what is the day time, things like that, what they had for breakfast and things like that, whether they are able to recall accurately. So this anybody can do at home. So all those little things tell us a lot of information. So these can be used as bedside testing. So as sir said, MMSE, which is also can be done by not a very well trained, but it's a basic test. We give them a circle to draw and ask them that if this is a clock face, please put all the numbers inside, and those are the tasks. There's something called a trail making test. So alternate sequence of ascending letters and numbers. So those are the little things which we can do at the bedside. And certainly a lot of testing of at the by the neuropsychologist will help as well.
Mhm. Okay. And Priya, did you find any tests or signs that you would say one should watch out for?
And as I said, even before, once my mother fell, of course, then the memory loss suddenly, it was a very sudden onset of the short-term memory loss spurred by that fall where she had to have a hip replacement. But before that, also, I used to find a lot of anger, a lot of insecurity about herself. She would, want to write everything down in terms of, she was living alone. So when we are coming, she would write it down on a calendar, 1:30 or 2:30, and get the days a bit mixed up. But then that one thought is also because she was 79 at that point. She's now 81. So last 3 years I've been dealing with this. So her late 70s, one thought that this was just forgetfulness. She's also stopped working ever since she was 60, just staying at home, things, and one didn't trouble her. I think the whole thing was that there was insecurity. There were a lot of red flags that we look at it now. She was always, as I told you earlier, she stopped dressing up, she stopped going out, she stopped interacting. Her whole conversation also became related to one or two topics, and they were very repetitive on the same topics. She was very well aware of what's happening. She was reading the newspaper, so she was not out of touch with what's happening, but she was just focusing on just 2-3 things mainly. So those, and from her, there was a personality change. She became more insecure, less less confidence of herself, etc. So I saw all those signs, which later on realized that they were, I think, red flags of depression more than dementia. The doctors would know. Now, what she's going through is definitely the forgetting things, forgetting what she had for breakfast, forgetting people who come. She remembers, but like someone came last week, she still think, oh, he came yesterday. That person, So she gets these people confused. But at least she's remembering. We did the MRI, Dr. Ranjan, as I had pointed earlier, which said that she's suffering from age-related atrophy. But beyond that, I can see a degeneration happening in terms of the memory. But apart from that, the cognitive functions are more or less okay so far.
So, Dr. Ranjan, I wanted to ask you one thing. So, like Priya said earlier, that you need a full-time carer. Are there any other solutions that we can offer people listening in?
See, the point is, obviously, as Priya very rightly said, the management of a patient of dementia, cognitive disturbances, is just not only drugs, but it is much more than that. Unfortunately, we neurologists don't have any wonder drug for Alzheimer's or any neurodegenerative disorder. So my advice to the patients my advice to the caretakers are, please look after 4 or 5 things. First, avoid these patients from falls. Fall is a very, very bad thing. And you can imagine, if a patient with dementia falls down, their 70s and 80s, they have a fractured neck of fever. Once you have a fractured neck of fever, you're in the bed, the decline starts. 2, with age, there are a lot of metabolic factors which play a role. For reasons, they lose sodium from the brain, which is called cerebral salt wasting syndrome. I tell you very often, in my own hospital, the Apollo patients are brought with altered sensorium, altered level of consciousness, and they just have low sodiums. So please watch out that. Third, bed sores. 4, diet. 5 chest infections. Their diet has to be taken care of. And of course, with that, physiotherapy. And I don't know, the drugs, I would go, I mean, maybe Dr. Bangar may not agree with me. If the patient is not even regular with his drug, except that he looks after his diabetes, hypertension, it's fine with me. But I want him to be in a total care. And I tell you one thing, that the care of a dementic patient is not an easy job. Is not at all an easy job. Because they develop a lot of problems in the sense, personality changes. They are restless, suspicion, arrogance, anger. So it sort of works up the whole family.
Yes, absolutely. And Dr. Bangar, would you like to add anything to how we can help people, or even games, or that people can start doing it in earlier age to prevent getting to this stage? Games, apps they can use.
Yeah. So I would just add to what Sir said. It's a disease not only of the person, but it affects the whole family. So when we are treating, we treat the whole family. As Priya would agree that it has taken so much toll on her own well-being, both mental and physical. So we include the family right from day one, because the person's dementia will slowly and gradually decline, and they may not remember going forward what they were, say, few months ago, or who's looking after them, whether it is their son they may mistake for, say, son-in-law or brother, and so on and so forth. So it is important that you keep fit as an individual looking after your loved one, because if you're not well, your loved one is going to suffer immensely. So coming to your question about how we can deal with this, because it is a dreadful illness. There is no cure for that. It's been around for so many decades and decades. There is no cure. There are more than 250 molecules which have failed trials. So it is a disease which is not going to go away anytime soon. And the incidence, or what we call as prevalence, is increasing day by day because people are living longer. But having a healthy and a balanced diet, quitting smoking, drinking in moderation, 6 to 8 hours of good quality refreshing sleep, getting your eyes and ears checked, because hearing loss is also an indirect risk factor. More and more studies are done these days. So all this, what we call as annual health checkup, must not be taken lightly. We should have our vitamins tested. So vitamin B12, Sir talked about reversible dementia, so vitamin B12, hypothyroidism, and vitamin D is coming in a long way. So all these are treatable and preventable things, not only for mental but for your physical health also. So eating salt in moderation, avoiding sugar, exercise is so very important. Only 30 minutes every day. I mean, it doesn't have to be a vigorous exercise. Even moderate brisk walking is good enough, and that is along with your daily walks. You may be walking to work, walking from work, and walking during work, but 30 minutes of dedicated half an hour every day is very, very important. And you talked about crosswords, Sudoku. So those are all brain exercises, and they can help immensely. So there are variety of them. You have apps, because we seem to do everything on the phone these days. So apps at your fingertips are there. But keeping your brain active is very important. Do not forget social contact, because that's also risk factors.
Thank you for that, because Priya, in your article, I know you mentioned limiting social interactions did affect your mom's health. But Dr. Renjen, I have the last question for you, and that is, what other diseases of the aging brain would you classify that people should watch out for?
Well, see, the point is that Alzheimer's disease, then we talk about Parkinson's disease. And I think when we talk about a dementia, we talk about a progressive dementia. Alzheimer's is the first, and Parkinson's disease is the second most common neurodegenerative disease. It's very interesting that 10 to 15% of patients of Parkinson's disease have dementia at a later stage of the illness. But when Parkinson's disease starts, it starts with a tremor on one side, difficulty in walking, and slowness of movement. So that is what is a Parkinson's disease. And I must tell you that Parkinson's disease is absolutely misdiagnosed. I won't say Parkinson's disease, which was described by Sir James Parkinson in the 1800s, is a curative disease. But I have a wonderful drug, which is called L-Dopa, Sendopa, which to a large extent improves the symptomatology of the patient. Now, it's a progressive disease. It's a progressive neurodegenerative disorder. So I think when you talk about dementia, when you talk about cognitive function, please don't localize yourself to that. Go a little further. Is it really cognitive disorder? Is it really memory? And Dr. Bangar very rightly said, mental health is the mental, social well-being of a person. If I keep on fighting my neighbors, if I'm an introvert the whole day, I'm sitting and grumbling, if I don't have any social life, I'm 100% going to have dementia. So that is my advice to people whose parents have dementia. Be cool, be kind, and be sympathetic and empathetic towards them. And you'll get the results yourself.
That's wonderful advice. I'm going to do a very quick summary before we go. So Priya, what is the toughest challenge as a caregiver that you've had to face?
All that Dr. Renjen just said, be cool, be calm, be wise. I think all those are my biggest challenges, because I begin the day by saying, I will not lose my temper, I will not. But there is something, you try not to, at least in front of her, but there is something that just gets you it's a very difficult ride to do over. For me also, I'm going through the same pattern over and over again.
Priya, I wanted to ask you, what is the biggest tip that's helped you, or what's helped you the most?
It's not personal, and someone told me that this is not your mother anymore. If you can distance your mother, the individual, from the patient, she is now a patient. That has helped me, because I have to have that 3 steps away. Otherwise, I keep wondering, I say, what happened to my mother? Is this my mother? Do I scold her? When she's sitting and having, she gets fixated, she'll have a whole bowl of kaju. She'll, you have to tell her, don't eat this, eat that. She's argumentative. You have to sometimes tell her not to be rude to this, her maid or something. So, you become the parent. So I cannot imagine her as my mother. So someone told me that is not your mother. Now she is a patient. And I think that advice has really helped me deal with her.
Thank you, Priya. And lastly, how do you care for yourself?
How do I care for myself? By working. I never thought work would be so helpful. But yes, I totally agree. The advice given here is, go for that walk. It has really helped me in the last 3-4 months. I've been 24/7 with my mom because we had some issue with her attendance. So I needed that walk. That really clears my mind.
Okay. Wonderful. Thank you. Dr. Bangar, 3 signs that people should seek help.
See, as a geriatric psychiatrist, I would say, memory loss is one, change in the personality, and get your depression or anxiety treated.
Thank you for that. Any exercise to delay cognitive decline?
Well, the walking is one of the best. So you don't have to be a very religious gym goer. So, but walking or a treadmill, cross trainer, whatever you fancy, swimming, But other exercises which I was not able to touch upon is music, yoga, dance, Zumba. All those are very, very useful and effective techniques. Having a pet is a very soothing for the patient and the family as well. So there is animal assisted therapy, as we call it. So that's very useful.
Lovely. And one important way of giving support to the person.
So this is a little bit personal to Priya, but as long as you know you're looking after your mother, it is all that matters. If your mother cannot acknowledge you as her daughter, that is part of the illness. So don't take it very personally. uh, don't feel guilty that you're not doing enough, because that's one of the major things that suffers in the carers is their own mental health is affected. They feel guilty, they go through a lot. Insomnia is hugely common.
Thank you, sir. Dr. Renjen, one mistake, sir, that you think people make when it comes to mind-related issues?
One thing which they mistake is that they think everything is fine. Where I give most important is a change in personality of the patient. If a patient's family tells me that, doc, she was a very nice lady, she used to go out, now she suddenly become withdrawn, there's something wrong.
Okay. And one tip to caregivers?
Caregiver, please be cool. Treat your patient, whether your mother, as a patient, as a doctor, doesn't matter. But treat with a lot of sympathy and empathy.
Thank you. And one piece of advice to keep our brains working?
Two things are very important. And so that's what I do. One, regular exercise. Number two, keep your brain working. Keep on reading something. I must tell you, I read every day for about an hour and a half or two. The day I don't read, I think something is missing. If I go out for a holiday for a week and I have not read anything, when I come back, I'm a zombie.
Lovely. Thank you so much. Thank you for joining us today, and thank you for the viewers. I hope you learned something new, and I hope we've got you closer to leading a happier, more hopeful, and healthier life. If you like this chat, please share it, please press like, and please subscribe to this channel. Thank you.